Good afternoon, everyone. Today, our group, Anthony, Cindy, and me, Katia, are going to be presenting about mammograms as a diagnostic tool for breast cancer. But what is breast cancer? Breast cancer is the abnormal growth of the cells lining in between the ducts and the lobules of the breast. These cells grow uncontrollably and pose a threat to other parts of the body by spreading. The symptoms of breast cancer include new lumps thickening in the breast or underarm, nipple discharge, change in size of the breast, and sore nipples. But why is breast cancer an issue? By statistics, 1 in 8 women and 1 in 651 men in New South Wales are being diagnosed with breast cancer. It's important to mention that breast cancer is not only found in women, but also in men, although it's very uncommon. Now, what is a mammogram? Mammogram is an X-ray of the breast tissue to search for any symptoms, such as lumps or tumors. But why mammograms? Mammograms produce the highest image quality that the examination requires in search of soft tissue masses or microcalcification. Considering its accuracy towards early diagnosis, physicians classify mammograms as a key element for breast cancer treatment. Now we're going to talk about what does mammograms consist of. So first we have the X-ray tube anode, which regulates the voltage and produces the low energy X-ray. Then we have a filter, which is used to reduce the patient's exposure to X-ray beams. Then we have focal spots. There are 2 focal spots in the X-ray tube, which are used to identify calcification patterns. Then we have compression. Compression is used to reduce the thickness and blurry motion, so doctors have a better visualization of the tissues. Digital receptor or screen, and the grid, which is used for the contrast sensitivity. And then we have an image here to show you how the machine looks like. Now I would like to pass the time to Anthony.
Thank you, Katia, for passing the time to me. Now I'm going to discuss what does mammograms emit. Unlike to other medical physics application, mammogram emits radiation. So how is radiation created? Actually, a low dose of energy of radiation is created through its anode and cathode. And when a stream of electron goes through and is accelerated with high velocity, which collide with each other inside the anode and cathode, a radiation can be created. So for the mammogram, the kilovoltage required are usually at the range of 25 to 50 kVp, which is comparatively low and safe to use. Okay, so how does mammogram scan image? First, the compressor will compress the breast in different angles. And here is the breast compressor. And mainly it compresses, I'll use this as a breast, compress it horizontally and vertically. And then the angle tube will emit X-ray, which is this blue chunks above it to emit X-ray as well. And finally, the digital detector under the breast, which is the yellow one, will take a picture and send it to the doctor for it to examine the breast tissue inside. And so, you may ask the question is why the breast is compressed. Actually, the breast is compressed is to reduce the thickness of the breast. So we can create a blurry motion and the doctor have a better view of tissue. It means that if the breast is too thick, there may be some of the normal cells above that cover the abnormal cells downstairs, which the doctor cannot examine. However, through compression, now it can be compressed and the area is enlarged, so we can see both abnormal cells if it is found under the breast. And then, actually, how is radiation limited? To us, radiation is hazardous, and it is our duty to reduce the radiation as much as possible. So it's like an X-ray tube. The filter is inserted to enhance the contrast of sensitivity, to optimize the accuracy and identifying early age of breast cancer. Also, there's a photo timer inserted in the mammogram, which is to limit the time for the picture taken of the breast. So, through limiting the time, the mammogram can limit the exposure of the patients to the radiation. And finally, mammogram X-ray energy. Actually, the energy used for patient is a low energy X-ray. As mentioned, it's ranging from 25 to 50 kPV. However, in real life situation, technicians and radiotherapists will arrange the radiation and adjust it depending on the breast size. So it means that the bigger the breast, the longer the time it compresses and the longer the time it takes to take the image. And yeah, thank you. Now I'm going to pass the time to Cindy to discuss evaluation and radiation.
Thanks, Anthony, for passing me the presentation. So mammogram use small amount of radiation. This radiation will pass through the body and part of it is absorbed by the bones. The radiation may enhance the risk of developing breast cancer, but with such small amount of radiation, the possibility is very low. As mammogram is a radiation diagnostic tool, patient will be exposed to a dose of radiation. This amount of radiation may affect pregnant women as the risk of radiation exposure to the fetus is very high. One downside of mammogram is for positive results. When the image presents signs of cancer, but in reality there is no cancer in breast. The chance of having full result after one mammogram range from 7 to 12% depending on age. There is a high chance of younger women and women with dense breasts in this range. So mammogram use low dose of radiation and it detects the presence of cancer accurately compared to ultrasound. Thermography use heat wave and record temperature change on the surface of the skin. Its limitation is the abnormalities in breast cannot be shown, so the result is less accurate than the mammogram. So in conclusion, mammogram is an effective tool to diagnose breast cancer. It is the oldest, simplest technology for breast cancer detection. The reliability of mammographic image is affected by sound radiations and breast compression. Such aspects emphasize the importance of physical principles to achieve optimal results for clinical diagnosis.
Thank you for your attention.